Welcome back to part 2 of our educational series on tennis elbow. Today we're going to talk about what kind of tests are going to be positive and what kind of symptoms you can experience. So when we're looking at tennis elbow, we're going to assess movements of the forearm and the wrist and the elbow. So when we're doing our assessment, some of the most common things we find that would lead to discomfort would be if somebody's wrist is being pulled into a flexed position. They would feel some tightness in pulling and maybe a bit of discomfort. We also might see some discomfort with active wrist extension, which is this direction of movement, again in that area over the outer elbow. We also might see a limitation in their ability to pronate the wrist, as that would also cause some tension and pulling here. As we get into our special tests, we'll notice that the patient might experience pain with resisted wrist extension and radial deviation. So as we push down through the hand, they're going to experience some discomfort through this section of the elbow, or with the resisted middle finger extension test, this would also cause pain in that same area. Finally, if we palpate the area and we poke through that tendon insertion into the lateral epicondyle and epicondylar ridge, it's going to be very sensitive to touch, and we might also notice that there's a bit of extra tension and muscle tone through those forearm extensor muscles that might lead to some discomfort as well. And finally, like we talked about in the first video, if there's any nerve symptoms present, such as numbness and tingling down the backside of the wrist and hand, when we do a radial nerve tension test to look at how well that nerve is moving down the upper extremity, they may experience an increased level of symptoms on their affected side compared to their unaffected side.